Welcome to American Dreams, Keys to Success, with your host, Alan Olsen.
Welcome back. We're here today with Dennis Wolfe. Dennis is a healthcare consultant specialist, and I want to talk about nationalized healthcare. Dennis, welcome to today's show.
Thanks for having me back on. It's a pleasure to be here.
So, Dennis, what's your thoughts on a nationalized healthcare program?
I guess the best answer to give to that is, why do we need to sell all different types of cars? Let's just sell one car. Everybody buy the same car. In Russia, they did it. It was called the ZIL. And in America, why don't we get rid of every car manufacturer and just sell one car? Nationalized healthcare is exactly that analogy. If we get rid of all of the insurance carriers, each one approaching the market from a different perspective. For example, one particular carrier specializes in really good negotiated deals with hospitals around the country. Another one has a great network of medical foundation clinics, etc. And each one comes in with a different premium cost. People can choose. That's competition. Nationalized healthcare is one car. And ultimately, that's going to break down because eventually no one's going to want that system when it does not deliver the care. That's the problem with nationalized healthcare, because you're at the mercy of the government now designing a single insurance policy.
One thing that's always bothered me is the rule makers, when they set this up, they exempted themselves from being subject to the rules.
Sure.
And it's never really, it never really is discussed in all these meetings, and, why Congress says that we don't have to follow these rules. What are your thoughts there?
You're raising an interesting issue, because it has been my contention that whenever a government moves towards the adoption of a nationalized healthcare delivery system and a nationally funded, i.e. a single payer, that these systems are not designed to give care. They're designed to limit care. So naturally, if you limit care and you're the rule makers, as you use the phrase, then the last thing you want to do is limit your own care. So that's why they don't limit their own care. It's that simple.
Do you feel that this Affordable Health Care Act will change the culture in terms of health care, what we see
Absolutely.
today?
I think you're going to see. And let me back up what I said just a minute ago when I said nationalized healthcare does not deliver more care, it limits care. So as a result of that, any type of nationalized healthcare system is not in the business of delivering care, it's in the business of denying care. And the reason for that is real simple. When you have a single funding vehicle, such as a single payer nationalized health insurance plan, you're limited by the ability to fund it solely by the amount of money the government could take in and deliver. Well, if their limits are if funds are limited, said that reversed, then ultimately the way that you handle it is you have to then cut back on what you pay for. And that you're going to see is the demise of the doctor groups, the private doctors. And with less doctors, the demand is still there. Prices are going to go up, but there's no money. Therefore, care will be limited.
So last time you were on the show here, you said that government healthcare always fails. Why do you feel that way?
Well, the reason it fails is because, as Margaret Thatcher said, socialism works until you run out of other people's money. And when you have only a finite pool of money to deliver the cost and funding of healthcare, and that pool becomes more limited, and you have people continuing to need care, and as we age, we need more care, then ultimately you run out. And what President Obama did, and I'm still amazed that people are in denial over this, in cutting $716 billion out of the Medicare budget, he effectively eviscerated the care for seniors. And they're starting to trickle down. They're starting to find that out right now. So we're going to see more and more funding cuts, and that ultimately means the demise of the healthcare system, and it'll only be for the haves, not the have-nots. Hence the earlier comment, the rule makers exempted themselves.
So what should we do today? If I'm sitting here realizing that we're on a different healthcare program, should I take any precautionary measures? Or
if I were the average citizen in this country, I would focus on doing everything I could to get as healthy as I could and become less dependent on the system. And by removing yourself from that grid, you have the potential to do the best you can to stay healthy, to do the best you can to get away from seeing doctors all the time.
I'm visiting here today with Dennis Wolfe, a healthcare consultant. We've been talking about the Affordable Health Care Act. Dennis, is there a place that we can go? Do you have a website or place where we can learn more about this?
I do. We are just about to go nationwide on it. We've been working on it for a long time. As well, and the address is 1-800-WE-CARE-FOR-YOU, and you can spell it any way you want, 1-800-WECAREFORYOU.com.
And what exactly will I find there?
You have a glossary, so you can ask, you have to register, it's free. You have a glossary that you can look up different words, understand different things. They have a page called Laughter, which is Learn and Understand Good Health Through Educational Resources, which has links all over the country to healthcare facilities, so people know where care is rendered, where they can get care anywhere they're in the country. And then there's tracking to track claims, and there's we're developing the advocate page. So it's a comprehensive site.
Now, you also wrote a book, Sick Solution.
I did. In 1991, it was published.
You saw this was coming down.
Predicted it. Yeah. Predicted it. It was inevitable. And if people ask me what I saw, it wasn't what I saw per se politically. It's just mathematics. When you have a monopolistic system of care and you do not deal with the competition aspect of it or do not inject it, you eventually create this disaster. And here we are.
Dennis, we got to take a quick break. We'll be right back after these messages.
Protecting your family's health and welfare is a sacred trust. At Greenstein Rogoff Olsen Company, we know that sound financial planning will protect them now and in the future. We're certified public accountants with tax services for the highly successful. For your business and your family, call GrowCo.
Greenstein Rogoff Olsen Company will help you manage your financial affairs so you can focus on what's really important in life.
GrowCo, helping you along the way.
Apple pie, baseball, and now here's All-American Alan Olsen.
Welcome back. We're here today visiting with Dennis Wolfe. He's a healthcare consultant, and we've been talking about the Affordable Health Care Act as it goes into effect in the year 2013. Dennis, before the break, we're talking about the introduction of these healthcare rules. And what was the main problem with our healthcare system before we brought in this, I'll just call it Obamacare. I think he
calls it that.
Yeah. Obamacare, and which of these issues does the new system address?
Well, let's go back to the first part of that question. What were the problems that existed before? There is a constant problem that is in the delivery of health care. It's a monopolistic system. Two doctors side by side. One doctor sees the other doctor pull up in a brand new car. He asks, how did you do that? And the first doctor says, I just raised my per visit copay. The next doctor doesn't go back and say, I'm going to lower mine so I can get more people. He raises his too. It's an inverse supply and demand system of care. And you and I cannot open, just as I cannot become a CPA without going through the proper designations and professional learning, I also cannot become a physician without proper designations and credentials. So I just can't open up a shingle next to a regular MD. So therefore, there's a limited competition, and it's a controlled competition, if you will. As a result, you have an inverse supply and demand. Prices are skyrocketing.
Yeah.
And when you have a skyrocketing price system, and then you have insurance companies doing all they can to contain that cost, the insurance companies, by definition, are going to get the blame because they're the ones that are having to raise their rates. So the system is breaking down, and you needed to throw away the system and revamp it. Obamacare came in and basically took a sledgehammer, and pounded down the system and made it worse.
So it was breaking down simply because it was regulated and people wanted the...
Well, it's not so much that it was regulated. It was that it was a system whereby the costs are going to creep up out of control anyway. You have a 1/5 or 1/6 of the nation's GDP growing at a geometric rate. If you look at the rule of 72 and the factors of how fast that particular portion of the economy is doubling in cost versus an arithmetic increase in 85% of the rest of the economy, eventually, and is now happening, this whole country is all it is about healthcare. And the proof of that, we're selling off businesses to other parts of the world for manufacturing. And now all we're focusing on is making medical devices and giving healthcare. So what I predicted in the early 90s is now coming to pass with the geometric increase of 1/6 of our economy becoming all of our economy. So you had a built-in problem. Now that the government's got involved, it just went from a disaster to cataclysmic failure.
Do you foresee any new problems that Obamacare will create for the healthcare industry?
Three. One, overregulation. And two, because if you go back to the question the answer I just gave, with the healthcare industry driving the dollars that build the GDP, a whole new level of taxation. And I have said from the beginning of this legislation that this had nothing to do with healthcare. It had to do with a new way to levy taxes on the growing economic base that healthcare is in this country. And so if you ask, do I foresee problems? Eventually we're going to take away the ability of people to get care completely because the taxes are so constrictive and they're being put onto people's backs in multiple directions. One, medical device taxes, which are going to affect the very things you buy in a pharmacy, supplies. Two, it's going to affect premiums. Premiums are not going to be affordable anymore. Therefore, people aren't going to be able to buy insurance. And the third factor that's going to cripple it all is the government's going to go in and decide, well, since we have these controls in place, we're going to restrict who gets care so we can decide how to tax the whole system just in general for whatever we want. And that's what they're doing now with a new tax on insurance to pay for the people who don't want to buy insurance or who can't get insurance. We're watching an unfolding of a disaster that's going to take down this country.
So the reality is as this unfolds, this tax is not laid on the rich, but it's necessarily more on the lower to middle class at the same rate.
This is actually a statement of the profound ignorance of the average American population. I didn't say stupidity, just ignorance. People just don't understand this. And when they finally grasp it, it's going to be too late. The taxes on the middle class in this country are going to become so pervasive that everywhere they turn, here's a new tax. What's it for? It's to pay for health care. Well, I can't get health care. That's not the point. We got to pay for it. And that's the disaster.
I'm visiting here today with Dennis Wolfe on healthcare consulting and the impact of Obamacare within this country.
Nothing's more important than spending time with your family. At Greenstone Rogoff Olsen Company, we're trusted advisors to the highly successful. Our goal is to help you find the right strategy to protect your wealth for yourself and those you love. Kids, why do I feel like I've just had an audit? As trusted advisors to the highly successful, we'll make sure that you don't lose your shirt.
Roco helping you along the way.
Apple pie, baseball, and now here's All-American Alan Olsen.
Welcome back. We've been talking today with Dennis Wolfe. He's a healthcare consultant, and the topic has been the Affordable Health Care Act, as this goes into effect on January 1st of 2013. So, Dennis, how do you predict the healthcare industry will change over the next decade?
Well, the healthcare or the health insurance industry?
Well, let's take the health insurance.
All right, let's start with the health insurance. The health insurance companies right now are already under strict controls with their MLR, their minimum loss ratios. And the Department of Health and Human Services has already pretty much staked its ground and said these carriers have to live within certain limits. So what that means is you're going to see rates climb because as these carriers pay out more in claims, they've got to raise the rate to keep within that 80-20 minimum loss ratio or 85-15, I believe it is for individuals. It's irrelevant. It's still a certain preset amount. But whatever that amount is, the carriers are going to have to increase their rates. Ultimately, they're going to reach the level of unaffordability. So that means people are going to say, well, we just can't afford this anymore. And the government's going to say, well, we told you this was going to happen, when in fact they've created the problem that's going to lead to this unaffordability and limiting people's access to health care insurance cost protection. So I would say within 3 to 5 years, you'll pretty much see the disappearance of health insurance in this country, no matter what anybody says. The biggest issue that's going to be is to see how a Kaiser handles it, because they sell a prepaid health care plan. They're a little bit different than regular insurance companies. So it'll be fun to watch in a negative sense, if I may. With respect to the delivery system and healthcare, you're going to see more and more hospitals being pressured because right now new rules are in place that hospitals cannot get reimbursed by Medicare if they readmit a senior patient within 30 days of a previous discharge. So local hospitals all over are going to see their reimbursements cut by the federal government, but their obligation remains. They must admit a person if they're ill.
Now, review that rule again. So if I'm released from the hospital,
if you're on
and
Medicare,
I have to go back within 30 days, what happens?
I don't think people know this. And this is, again, going back to the $716 billion that was cut from Medicare funding by Obama. No matter what anybody says, it's not a matter of Republicans or Democrats. Obamacare did this.
Yeah.
And it's a fact. And so what that means is hospitals are limited on their reimbursement if they receive anything when they readmit a patient who comes back for a second round. My mother was in and out of the hospital throughout almost half of 2011's about from May till about September, when she ultimately went to a home and then died. And she was in and out, and they wouldn't have covered it because she was there before 30 days. So who pays for that? Well, local hospitals are going to have to eat that cost because they're a Medicare contracted hospital. So they have to accept what Medicare adjudicates the claim to be, processes the claim in the amount they're going to allow. So if a hospital bill is $20,000 on the first admission, the patient is discharged and then is readmitted, and this time the complications mean that the stays for another 2 weeks, you could see a bill of $50,000 or more, and Medicare says, well, no, we're not going to pay that. Well, who's eating that cost?
You know, I want to turn this discussion out to the effect of the healthcare cost on the businesses. And, recently in the news, there's been several companies that have come out and said, well, we're going to cut the average hour of our work week so we don't have to cover. But overall, where do you see this all going with the impact to businesses?
Well, I'm going to backtrack 20 plus years. And I'm going to go back to I believe it was Section 79 or Section 89. Now the number actually escapes me. But it was a legislation that was put in place by Ted Kennedy. Pushed it out there. The federal government passed it. It was signed into law. And it was all about making sure you completed tests. Discrimination tests similar to pension plans to make sure they're not top-heavy plans for the highly paid execs. So these were tests that were put into place. And every time you got a result, it created a problem with another one needed to do another test. The law became so cumbersome with tests to make sure everybody was treated fairly with respect to health care and other benefits, the cost and the economic benefit, that the law was ultimately repealed. Section 89, that's what it was, Section 89. It was ultimately repealed. And I think we're going to find ourselves in that situation. This law is folding back on itself with so many pieces of red tape that it's so convoluted no one can find the maze out. No one can use the maze to find a way out of this. And eventually, businesses are going to have to answer it by becoming more restrictive on what they do, and they're going to have to rebel and say, we're not doing this.
Who's enforcing this?
Well, that's an interesting question. The IRS, of course, hired thousands of new agents, received millions of dollars of new funding, and then the first thing they did is said, well, we're not going to enforce it if you don't buy health insurance. Wow. But that's in the law.
Millions or billions?
I think it was probably closer to hundreds of millions, if not billions of dollars. And this is all money that's coming off the top. Where's the money coming from? We are now using the good faith of the federal government to borrow money to keep the country operating. And we're getting closer to this ridiculous, I hate this term, fiscal cliff. It's not coming at the end of this year. It's coming through the form of what's going on with Obamacare and time the federal putting on the back of the federal government the whole cost of healthcare. The healthcare system is going to implode.
Wow.
And that, remember, in a prior part of our conversation, it represents 1/6 of the economy, but it's growing to become pervasive as the economy in this country.
So really what this is turning out to be is a huge smoke and mirror games for a large tax assessment against America.
Absolutely. I have said over and over, I've said it earlier in this show, I am on record, I will take a lie detector test. This law has nothing to do with health care. It has everything to do with how to raise taxes in a confiscatory manner on the middle class such that they cannot get out of it. They've got to pay it. And that's the real aberration in this program. And people are going to see it. They're going to go, what's going on here? But it's too late. I really don't see a way out unless this thing is either repealed. Now, what's interesting is there's a case right now working its way back up to the Supreme Court.
Okay.
And that case is a case that the court will be 5-2 with Roberts voting to strike down the law as unconstitutional. So it's coming.
So how do you protect yourself against this if you're a business owner?
As a business owner right now, I think you definitely have to provide health insurance to employees. The instability in the market is huge. People want to know they have coverage. Business owners should see it as an opportunity for now. And that way they're not the bad guys, because in a couple, 3 years, they're going to be able to say, hey, no longer affordable. And that way they're happy.
So, Dennis, how does a person contact you for more information?
1-800-WeCareForYou.com. It's my website. It's healthcare claims consulting. It's 1-800-WeCareForYou.com. And it's free register. And they can email at that site, contact us, and help us with the website grow around the country.
So that's 1-800-WE-CARE-FOR-YOU?
Yes, and you can spell 4 as an F-O-R, the number 4, Y-O-U, the letter U. You can forget the 1, doesn't matter. 1-800-WE-CARE-FOR-YOU, 800-WE-CARE-FOR-YOU.
Dennis, thank you for joining today's show.
You're welcome. Happy to be here.
We'll be right back after these messages.
You're listening to American Dreams with Alan Olsen on AM 1220 KDOW.